Hello everyone, this is the Shientist, and today I'm going to give an overview of a topic on electronic patient records, health literacy or health language, and the multidisciplinary team or MDT. And This is part of the Ztorm Focus series, introducing the Shientist, and this is a Ztorm Lobostics production. To begin with, I'm going to give an overview in around this topic. Again in three across three or four sections. There'll be a section around the introduction, some aspects and understanding around health literacy or health language in context of healthcare, and long-term condition groups, and then some focus around a discussion, highlighting some points of discussion, and some conclusions and summary, drawing in the topic in this subject entity in unison. And as with other audios and podcasts in this series, I will highlight a few references where listeners can look to identify further reading at their leisure, and of course, if they are interested or intrigued to find out more. So, to begin with, a bit of introduction around electronic patient records, health literacy, and the multidisciplinary team, or at least where that has been identified and evidenced. There is now more need for healthcare professionals, perhaps those on the front line, for example, clinicians in secondary care, and GPs, for example, in primary care, to enter dialogue with those across different different services that link to the underpinnings of overall patient care, so that there is a tighter integration or integrative practices across different not just between health sectors, but also aligning to services in and around the day-to-day that individuals and patients would encounter. In this context, though, or in this context, it must also be understood or appreciated that, again, where there has been a little bit of understanding in one of the previous audios in this series, a look around some understanding, or a focus around electronic patient records. There needs to be a kind of highlighted, though, that electronic patient records need to be supplemented in line to an extent where there is informed decision making from patients, individuals or carers, making their experiences and the quality around aspects of healthcare more personalized, and actually so that healthcare and planning and areas around taking ownership becomes more intertwined with patients moving in and around between different areas of their healthcare and aspects around their social care, and where and perhaps more so now than ever, because of how COVID-19 and where there have been, for example, restrictions, for example, that interplay needs to be understood, as to especially as to how, for example, patients, individuals, and even health professionals have navigated aspects of health or healthcare, so that there is no the quality of healthcare and endpoint is not compromised, or the quality is around healthcare is not compromised. There also needs to be a neutral neutral environments need to be a focus, really, as well, because that's for example where both patients and health professionals can come together to get a more understanding around aspects of healthcare, but also an awareness. So those places maybe online, maybe in the physical environment, but either way, there has to be a neutral neutral territories or areas, basically, where patients and the public can source or get resources, and learn from each other, and also ascertain literature and context to evidence aspects of their healthcare, albeit in primary care or in secondary care. So that is generally important. And patient-centered multidisciplinary teams can and should allow patients and carers to gain more understanding of how, for example, their electronic patient records are updated based on specific scenarios, for example, and also an awareness and more understanding of what, for example, certain tests and investigations mean, and how that understanding transpires, so that there really is patient benefit with aspects of health. With regard to that, and in regard to that, and I'll give a little bit of understanding as part of the introduction, a part of this introduction around health literacy as well, before focusing onto it in another section. Health literacy is actually predominantly a skill-based construct that doesn't really include motivational elements. That means literacy and language, when used in context of healthcare or health service, or even health, for example, communication, it's not done out of, for example, where patients are motivated to do that. There's actually there's evidence out there and literature out there to kind of bring an understanding of how patients and carers, for example, approach different aspects of healthcare and health literacy, and when they use, for example, certain language and terminology, for example, it's not really a motivational. It's if they are using language and terminology, then more often than not, in the same context as health professionals, is out of either, number one, it's automatic, or number two, it's out of necessity. And so using modalities to help improve areas of health literacy alone to determine the needs and requirements of patients and carers, and for example, to simplify instructions or directions for them as a result, it could compromise the patient health professional relationship, or that paradigm can present as a potential barrier. And that also means, in that context, and where that could be potentially compromised, that affects the patient and professional relationship to an extent that actually it can become quite where communication between patients and professionals can end up becoming more one-sided or slanted. So there is an ongoing need to support areas of growth and development in that context, because patients, individuals use and access health and healthcare in lots of different ways, and so the awareness and even the evidences around that need to be focused back into mainstream. So a question is here also. What would be advantageous, or sort of what further can be done, or what needs to happen? So by encouraging partnership or partnership working, that also changes the shift from and terminologies, for example, between patient and that being a category, and health professional and that being a category, to one where it's a bit more synchronicity, where basically patients and professionals, they both have they come in and they both have expertise around certain aspects of healthcare, irrespective of language in some context, or health literacy in some context, but also that that should also be understood, or if not understood, then at least appreciated, that the patients, if they're not using the same language or terminologies between health sectors, their understanding that they have should not pose a barrier to health professionals, and there shouldn't be any discourtesy, for example, between the two different types of professionals. By encouraging partnerships and inviting, for example, links between in areas of healthcare and health services around, for example, patient and public involvement, or PPI, for example, that adds an important discussion, and there is now a need, really, or requirement again, for patients to have that, to be involved, is to then actually have opportunities to have dialogue, and to prompt tighter integrated services between health sectors, and where patient and public involvement streams are, and where those focuses are, and for example, in healthcare services and healthcare research, for example, that is where the patients and public are needed most, to help provide understanding to researchers and health professionals, for example, so that there is a focus to areas of health, to specific areas of healthcare. And again, I give the example around long-term condition groups, and such partnerships and that collaborative working, or that nature of working, actually should see patients and professionals aligned and having more joined up thinking, but it would not merely enable individuals or patients to better understand health and treatment, or healthcare and healthcare services and treatment, but it also allows opportunity to realize how much patients also bring about a deeper public understanding of those things that are aligned to broader aspects of literacy, and where there may be where traditionally there has been compromise, and also where, for example, there may be inequity, and so on and so forth. And so the PPI aspects, and in context with, for example, language or literacy, that can bring a bit more of an interconnectivity between how they can how patients, for example, can highlight not just lived experiences, which more often than not is the realm in which these in the realm in which patient and public involvement functions, but also allows opportunity, for example, where patients could also, for example, have a health professional focus, and health professionals might also have a patient focus. So this is where, in a broader sense, that interconnectivity becomes more aligned, and there is those areas and compromises around aspects of, for example, where there might be evidences around poor practice, they can be better focused, so that patients really do benefit, or of course, if there's aspects of misconceptions and things, and areas that are not focused so much in the public domain, then those areas those things, through patient and public involvement efforts, can also be bridged. So the interconnectivity between healthcare research and science the overlook becomes more positive. I now want to highlight a bit more around, delve into health literacy a bit more. The use of the internet, for example, social media, again, aspects around social media have been highlighted in a previous audio and podcast, but in here I want to highlight that whilst it is broadly available in lots of different ways, and I've mentioned a few of those social media platforms or outlets in a previous audio podcast, so I won't really repeat that, but the fact that we know that there is lots of different ways for people to I suppose contextualize areas of their life, or their day-to-day, it does not mean that that necessarily suits everyone. However, so in contrast, as well, for example, patients whose first language, for example, is not English, approaching more methods to support focuses around health literacy and language has been and continues to be a challenge. Now, one might ask the question, well, for example, on social media, isn't there a way, for example, that someone can press, for example, or translate based on something that's been written or composed or contextualized, and can that not, once translated, can that be helpful? The answer is yes, it can be very helpful, but the translation that comes out might not be a direct translation. So let's say, for example, someone puts in let's say in the English language, they say my uncle, let's say, for example, my uncle went into hospital and had to have an X-ray or a test on his leg to rule out to rule out for example osteoarthritis or something like that. So that's written in English, for example, but the person's first language is not English. It might be a different language. Their first language might be something else, and whatever that translation comes out as, once hitting translate on the where there might be an option on social media, for example, or on the internet to press translate, then the translation in their language, their first language, it might not be direct. It might not be like for like, for example. And also it might work the other way as well, where it might not be like for like. So they could have an English language. The English language it is their first language, but their preference might be, for example, to have an understanding for their own documentation, for their own way of documenting in another language, in their own language or their first language. So so there can be challenges there, and so health literacy becomes more of a principally it becomes more of an issue and potentially a barrier when certain health terminology or medical words, or even those in areas of science, for example, are just very can be challenging, let's say, to translate, so that where, for example, if I give the word, if I say the word osteoarthritis in English and then try to translate that in a different language, then that might not mean, it might not have the same meaning. So that then needs additional for example, literature that can actually help, and that literature has to be accessible, and a health professional needs to be there needs to be able to provide that context in different languages where that might be appropriate. Using these different obviously using different social media outlets can have its advantage. There are advantages in some cases, but around aspects of healthcare is still to be explored, or there needs to be, for example, more examples, especially around where long-term condition groups are talked about and discussed, or where patients and maybe even professionals use them, but not actually where they are not just in areas of mainstream, but they need to be connected with evidence that supports and substantiates real issues in and amongst that long-term condition that social media platform has been organized around. Again, I give the example of one example which is evidenced and has been the case since its concept in 2009, was the focus around the renal patient support group, the RPSG, which at present has just over 280 research items, and focusing on different areas of kidney disease or nephrology practice, as well as the sciences and focuses across and interplays across over different social media as well, and it's been one good example, at least, where kidney care practice is concerned since 2009. And now has, at least my understanding is, has just over 9,000 members internationally, and different. It's a diverse social media platform, and there are people from various ethnicities, races, and backgrounds generally who are using the RPSG to help inform aspects of their healthcare through an online space, and so health literacy at least is being addressed, where patients and carers using the platform are using the same language health professionals are using, and they become experts, or they become more more about taking ownership, at least in some aspects of their healthcare. As such, the as such as well, the patient may gain some of the understanding, however does not have the mindset always to take action. There was actually work by Salter in 2000, Salter and team in 2014. They highlight that what can be learned, that what can be understood or learned from patients or individuals living with chronic musculoskeletal conditions, health professionals and carers can learn that that patients want pragmatic or practical understanding or context around areas of healthcare that they may have to navigate and deal with. Empowerment then follows, and then, apart from where for example taking ownership is important, before taking ownership they then both health professionals and patients actually have a shared responsibility, and that is important in relating to interaction and being able to have a move towards more joined up thinking between the two focuses, either being a patient or being a professional. A little bit around a little bit of more discussion really on the two areas, health, i.e. again health literacy, and kind of what can be learned, what can we learn from this sort of these sorts of examples. Well, it is possible to inform, and it is possible, entirely possible for patients and professionals to be more interconnected and interactive, whether that's in a face-to-face environment, in a physical environment, or on a virtually or through social media, but it is actually where there needs to be without making this a formal perspective, but there has to be, or there should be, well-designed context that supports the patient's the patient and the professional to help bridge areas of information information needs and educational needs, and ultimately where health literacy becomes a bit more approachable. And that needs to come from those health professionals or the multidisciplinary team who are trained to give that understanding, or give to align resources for patient benefit. And that has been highlighted by work by King and team in 2011, and before that as well, O'Connor and that team in 2009. Importantly, more evidence has shed light on that, how low levels of health literacy tend to defer to those with low levels of health literacy, either that they don't want to take a responsibility, or they have other challenges which preclude them from taking ownership as well. And so such individuals, patients, and even carers, for example, tend to refer back to health professionals more directly to make decisions for them, and also tend to have potentially poor or negative experiences around healthcare, and so that is where actually examples that have come out from the renal patient support group, and I give that example again, the RPSG, where by patients having at least initial discussions in a closed through a closed social media platform, they're able to make more informed decisions and participate more actively in aspects of their health care. That should be a fundamental, really, in this day and age, but also where health professionals also need to be participate more actively to actually involve patients in those things that are related to professionalism. Now, that might sound a bit potentially far-fetched or a bit harsh, but actually, if we're not just talking about health literacy in one way or another, and publications, for example, by Nutbeam in 2000 and Nutbeam in 2018, look at health literacy and aspects of language, and evidence in context in literature, then if that's the case, then actually health professionals do realize that there has been a problem, or it has been problematic over over some time, and so therefore bridging that where there's disjointedness, there needs to be patients and professionals talking about those areas, and where there's barriers and potential hindrances, where language and literacy has taken hold of people's inability to potentially take responsibility. So educational support again needs to come back into the mainstream and link back into areas of patient care, and it is really a responsibility upon different members of the multidisciplinary team and healthcare professionals to actually ensure that that is something that is becomes entirely grassroots. So now I want to just give some overall conclusions and then a summary, and again I will read out a few resources that people who are listening, those of you listening, can look toward. So given that, so some conclusions first. Given that more patients and the public have opportunity to access their electronic patient records or electronic health records, there needs to be partnerships and collaborative working such that there's an integration allowing all to access health related literature, whether that's through paper publications using books or even digital media that link evidence base. And so, and it has to be papers and publications may seem or might be quite intimidating initially, but that is what how when patients look for information, or individuals or even carers look for information, primarily as mentioned, if they're not very proactive in looking for aspects to help with aspects of their healthcare more specifically, then quite obviously there will be the same areas and negative or compromised experiences that have been happening retrospectively. So there has to be or should be ways that even literature around the sciences, for example, publications that health professionals collaborate and focus around, that they can actually help bring that understanding to the very patients that they provide healthcare for. And also there should be an ability where that can be approached through digital media, for example, wherever there's a way to make it interactive and comfortable. That should be the approach, and it should take place and in a setting that also has health professionals and patients really where they can again interact in a natural and neutral environment, where traditionally there's that doctor-patient relationship, for example, and that's that's isolated in the arena where isolated in consultation areas, for example, which feel quite intimidating. For example, there's a lot of literature out there that document, for example, um, causes of hypertension or high blood pressure and white coat syndrome, for example, that's one of the barriers of consultation areas when patients or carers, those who go to those environments, and maybe there's a health professional in a white coat, for example, a clinician, then just seeing that health professional in a white coat, can potentially increase the patient's blood pressure. At least that's in literature where health professionals who have that expertise have documented that has been what's been highlighted in the evidence. And so there has to be, or should be, ways to be able to interact through digital modalities, and where the MDT with patients can come together online, so that, for example, or remotely, if it's face to face or in a physical environment, then natural spaces, or neutral spaces, and so that way it bridges that patient and professional barrier that has been problematic for a number of years. And there must be more unilateral thinking, really, to ensure diversity and inclusion of different populations when developing or improving healthcare services and even healthcare research. The RPSG has piloted a few multidisciplinary, or MDT, like webinars where different professionals and patients have come together to provide educational support, and that sort of effort has been highlighted in and around the RPSG's, for example, their educational YouTube channel has over 80 different educational videos, which bring understanding or context in across different, allowing patients and professionals to interact through slide set presentations, MDT style type webinars, silent silent educational slide sets, and other sort of context that being provided by different kinds of professionals and patients as well. So that's at least one example of that's happening, and that there needs to be more of that understanding and development through healthcare research as well, and patient and public involvement, or PPI, that actually can bring about more diversity and inclusion, as long as lead researchers are making that part and parcel of what they're doing. And then there's also finally an overall summary here. Partnership working can allow reliable professional guidance, such that patients and the public can find more approachable at a time, and at their own leisure, and actually if there are health literacy issues, or where language barrier might be a problem, or then there should be professionals available to be able to translate, or be ready to translate context in a format patients would need or require, and that they can understand, so that they can understand from and learn as well. In this context then, and finally really, electronic patient records and multidisciplinary team initiatives should be an effort, an integrated effort really, where there are healthcare partnerships, and this needs to be encouraged, so that there is more naturalistic approaches to healthcare, so that actually patients and professionals have more aligned ways of working out different aspects of healthcare, and ultimately being able to navigate healthcare is something that everyone wants to be able to do. So now I'm just going to give some resources, or read out a few resources for further reading, and people can do that. Listeners can go, do that in their own time. And so a few here include a report or a publication by Barnett and team in 2012, where they write on epidemiology of multimorbidity and implications for healthcare research and medical education. And this is a cross-sectional study that's published in the Lancet. There's a document by the Department of Health in 2012, where they document a context on long-term conditions, long-term conditions compendium of information. There was a third edition, and that's available online, and it's downloadable for free as well, I think. There's also a paper by a report, and it's probably a good starting point, by an author called De Silva in 2011, and they published on the Health Foundation, helping people help themselves, and that came from the Health Foundation, and that's downloadable as well. There's a paper by a report really, and it's another publication from 2011, and I mentioned this in a previous audio in this series, by Coulter and Collins in 2011, where they published work on shared decision making, a reality, no decision about me without me, and that's accessible online as well. There's a paper by Jones and Dutton in 2014, where they look at work on patients and families as partners in safety, quality, and experiences of care, and that was published in the Patient Experience Journal, and it's actually quite a good read as well. Again, there's that an example by Mohammed and team of the Renal Patient Support Group, supporting patients with chronic kidney disease through social media, and that was published in the Journal of Renal Care. I believe that's accessible. If those who are listening want to try and check out the RPSG, they do have a what they call a ResearchGate page, and that ResearchGate page documents or highlights a good number of publications, including this particular publications, and through ResearchGate, generally through what's been highlighted through the RPSG is downloadable and available for those who are intrigued to find out more. And then finally, there is a paper, a report. I will highlight this report. It's more about electronic patient records and how health records can become should be more integrative. And this is a this report is called the Patient Online Roadmap, and it was published in 2011. That should be downloadable if you put in that information into your search engines. You should be able to get access to that. I want to draw this to a close now. Thank you for listening. This has been another great opportunity to highlight different context. This time it was around electronic patient records, health literacy, and the Multidisciplinary Team, or MDT. And this audio podcast ends this series on the Ztorm focus and introducing the Shientist. I look forward to bringing out another series in due course, or in due time, and hopefully that will be have another area of focus that around the sciences and aspects of healthcare and research. Make sure you look out for that one. This has been another Ztorm Lobostics production. Thank you for listening.